Hi, I'm Dr. Blanche Grube, and today I'd like to talk a little bit about children's dentistry. Now, the reason I emphasize little is because children's dentistry is a huge field, and it's an important field. But Dr. Blanche Grube has been told that she is opinionated, and yes, I am. Okay, so now we got that clear. I am opinionated, and I do believe that children's dentistry should be treated very differently than the way it is today in 99% of the offices, in the dental offices in this country. Okay, so number one on my list, the best way for children to receive dentistry is, y'all ready for this? Not at all. Prevention is number one on the list. Quit giving children soda. Quit giving children candy, ice cream, cookies, all the refined carbohydrates that dissolve their bodies. You notice I didn't say dissolve their teeth, because that's what people used to believe. People used to believe that the sugar from the food literally produced acid in your mouth and that the acid dissolved away their teeth. That's just not true. That is simply not true. When you consume high amounts of sugar, the pH in your body changes. The mineralization in your body changes. The whole body chemistry changes. And as soon as that mineralization drops to a point that's critical, the minerals in your teeth begin to dissolve out. It doesn't matter if you gobbled down that Hershey bar, drank your soda, and then went and rushed to brush your teeth. It doesn't matter. Once that sugar is in the body, it is going to cause decay, not just in the teeth, but everywhere in the body. There was a scientist by the name of Ralph Steinman who wanted to research and wanted to know what were the direct causes of consumption of sugar in the body and tooth decay. So he took some mice, and what he did was he gave this group of mice a sugary solution to consume. This group of mice got none. Obviously, the first group of rats or mice were the ones that got decay, and the ones that had no sugar did not. Okay, doesn't take a research scientist to figure that one out. What he did next, though, was a little bit more interesting. He put a tube down the stomachs of the mice and fed them sugar. So the sugar never touched their teeth. And of course, the group over here, again, you guessed it, got no sugar. What happened? The group that had the sugar pumped into their stomachs still got decay. What happened next is even more interesting. He took the sugar solution and injected it into their muscle. So it never even entered into the whole digestive tract. Well, that's fascinating, because the group of mice that had the sugar injected into their muscles got decay. The group that had no sugar, no decay. The conclusion that he came to from this study was that the sugar changes the chemistry of the body, not just the teeth, the whole body. So I tell all of my patients, decay is a systemic disease. If you have a cavity in a tooth, you never have, and I'll say it again, you never have just a cavity in a tooth. Your whole body is decaying. The whole body's falling apart. And that's what sugar does to us. Sometimes I have these crazy fantasies. If we could magically erase all the sugar from the whole planet, all of a sudden there is no sugar. There's also no black market for sugar. I bet you could probably close half of the hospitals in the world probably within 6 months. Because diabetes is on an increase astronomically high. And then all of the repercussions from diabetes, incredibly high amounts. Look at all of the other diseases, obesity. Not all obesity comes from sugar. My specific problem is coming from no thyroid gland at all, thanks to dentistry, thanks to mercury. I have no thyroid gland. But I do consume sugar. I'm not going to sit in front of the camera and tell you I never eat sugar. But when I do, sure, I see the pounds come right on. So obesity is a big problem. Diabetes is a big problem. Not everybody reacts to the sugar, though, the way we think they will. Not everybody gets diabetes or obesity. Some people will actually develop arthritis. Now, you normally would never think that arthritis would be something that would be coming from too much sugar in the body. But it is true. If you consume a lot of sugar and the body's deteriorating, it's deteriorating at the joints also, not just the teeth. So a tremendous amount of sugar in the diet will cause arthritis. There's a list of all kinds of diseases that are definitely made worse by the high consumption of sugar. Look at cancer. Cancer cells love sugar. Well, everybody loves sugar, but cancer cells really love sugar. There are actually some treatments for cancer where they deprive the body of sugar and then give the body a little bit of sugar, which rushes into the cancer cells, and then they follow it with either chemotherapy or sodium bicarbonate, and that zaps the cancer cells. They're gluttons for sugar. So, rule number 1, when it comes to children's dentistry, just avoid the sugar. And that has to be from the moment the child is born. If the child is not being breastfed, you can't be giving the child juices with lots of sugar in them. Even chocolate milk. I've seen parents give chocolate milk in a bottle to a kid and let the child have the bottle in their crib at night. All that stuff is going to be destroying not just the teeth, but the child's body itself. So prevention is number 1 on my list. But suppose your child is maybe 2 years old, now has all of their teeth, and you're starting to see little brown spots. That's the time to start bringing the child in as soon as possible. I mean, I would even say the age of 1.5 would be a good time to bring them in. But sometimes it's a little too wild at that point. As soon as you get the child to sit in a chair, relax for just a moment or two, bring them to the dental office. Get them used to being in the dental chair. In our office, we give them a ride. We bring the chair up, we bring the chair down. Visit's over. That's it. They get a prize as they leave. They begin to feel comfortable going to the dental office. The next time they come, we give them a ride up. We actually look at their teeth with a mirror. Visit's over. They come down and they get a toy. Then the next visit, we'll add one more little teeny step. It takes a tremendous amount of patience. It takes a tremendous effort on the part of the parents to be bringing the child back and forth to the dental office. But you must develop a relationship between the dentist and the child. That has to happen. If not, you're going to create what I call a dental monster. A child that goes into a dental office, is sat in the chair, is given an examination, is told they have 12 cavities, and then is sedated or strapped to the dental chair to start proceeding and doing some dental treatment, is creating a dental monster. This is somebody who's going to grow up as an adult hating the dental office and hating to get any of the necessary treatment completed. So, suppose your child does have a cavity and you've had the many getting to know you visits in the dental chair. Ideally, you want to treat the cavity when it's as small as possible. Again, don't rush to get a cavity taken care of when the child already has a toothache and there's a lot of pain and 90% of the filling is gone. If the child has a small cavity, should be taken care of unless the child is not trainable. So what do I mean by that? Well, take a look at children. I know everybody knows about the terrible twos, and they are terrible. They bounce off the wall, they've learned the word no, they throw temper tantrums. At 3 years old, they're also not trainable. A 4-year-old is right on the fence. Some of them are trainable, some of them are not trainable. A 5-year-old, definitely trainable. So if you have a 5-year-old that's never been to the dental office, now is the time to start taking them and getting them used to coming in and having some fun in the dental office. This way, when the day comes, and if they do need to have some dentistry done, they're already used to being in the dental office. They're already comfortable with the atmosphere, and they're not as fearful as a child who's coming in for the first time and needs to have work done right away. So let's look at the group from 5 to 12. This is an interesting period in their life because they have a mouth full of baby teeth. Some of them are actually starting to get loose and fall out. That would be their front teeth. And some of them are going to stay put until they're 12 years old. So you've got an interesting mixture going on. Each and every tooth has to be evaluated by the dentist if it has a cavity. You're going to have to make the decision with the dentist as the parent. Do we fill or do we not fill? For instance, if a child is 11 and a half years old and they have a cavity on a deciduous, what we call a baby molar, well, that molar is going to be out of their mouth in 6 months. Would you fill a tooth that's going to be out of the mouth in 6 months? I would not. Again, I've been told that I'm opinionated. That child should really just start wiggling the tooth and have it taken out. When it comes to children's dentistry, every time a child gets a cavity and every tooth that the child gets a cavity in has to be evaluated individually. Each situation is different. I like to play beat the clock. If I can, if the tooth has a small cavity and the tooth is loose, doesn't have much root structure left behind it, the second tooth is ready to pop up, leave it alone. Why put the child through that trauma? But if the child has a cavity in a tooth that's going to be in their mouth for another 5-6 years, it's a totally different situation. In that situation, you're going to have to fill that cavity, more likely than not. You're going to have to do a little bit of drilling, maybe scoop it out with a spoon, an instrument called a spoon, and fill it. The sooner that gets done, the better, especially if it's a good-sized cavity. Now, when I say fill it, I certainly don't mean with the silver mercury filling. When I say fill it, I mean fill it with one of the new composite materials that we have that bond just as well to children's teeth as they do to adult teeth. But again, when it comes to children's dentistry, you've got to take a look at each situation and analyze each one by one, and then take into consideration the behavior of the child. I'm always amazed at how some children are just absolute saints in the chair, and some children will wear the whole office out so that we all feel like we need a 2-week vacation after the child has left the office. So that's what I have to say today about children's dentistry. Thank you for listening, and continue to come back to get more different views on dentistry today. Thank you.